What if I told you that you could be eating healthy, exercising, and doing everything right, but still have a very high chance for heart attack? That's the reality for people with familial hypercholesterolemia. Most people don't know that they have it. Many found out after a heart attack, sometimes in their 30s or 40s. Today, we'll explain what familial hypercholesterolemia is, how it affects your heart, and how to get tested, and how to protect your family and yourself from this treatable disease. Stay tuned. Welcome back to Dr. Noni's Power Lab, where we talk about heart health in a clear, honest, and practical way. Today we have a very important and very exciting topic, which is familial hypercholesterolemia. If you or someone in your family has a very high cholesterol, early heart disease, or history of heart attack at the early age, this video is for you. We are talking about familial hypercholesterolemia, for short FH. So what is familial hypercholesterolemia? It's a genetic condition. It means that your body is born with a problem clearing LDL cholesterol, the bad cholesterol, from your blood. This is not caused by eating too much fat or being overweight or being lazy or poor lifestyle choices. Unfortunately, none of that. People with familial hypercholesterolemia can eat perfectly, exercise regularly, and still have very high LDL cholesterol. And that's the key difference. So here's the question: why FH is so dangerous? Well, LDL cholesterol, often called bad cholesterol, for a good reason. So when LDL stays high for years, it can slowly build up in your arteries, forming plaque. And this plaque causes narrowing, and narrowing can cause heart attacks and strokes. In familial hypercholesterolemia, this process starts very early, sometimes in childhood. That's why untreated familial hypercholesterolemia increases the risk of heart attack by 10 to 20 times, often before age of 50 and sometimes in their 30s and 40s. So, do we have signs that we can know if someone has familial hypercholesterolemia? You might suspect familial hypercholesterolemia if LDL is above 190, you have family members with early heart disease, heart attacks before the age of 55 in men and 65 in women, multiple relatives with cholesterol medications, and cholesterol that doesn't improve much with diet. That's a very important point. Some people also develop yellow deposits around the eye, tendon, denthomas in the hands and Achilles, and corneal arcus at a young age. But many people have no visible signs, and that's dangerous. So how to diagnose familial hypercholesterolemia? It's a combination of cholesterol level, family history, physical exam, and sometimes genetic testing. Here's the key red flag. If LDL cholesterol is above 190 in adults, especially if persistent, that's familial hypercholesterolemia. Genetic testing can confirm, but it's not always required to start treatment. If one person has familial hypercholesterolemia, you should screen the entire family. That's called cascade screening, and it saves lives. So what is the difference between familial hypercholesterolemia versus regular high cholesterol? That's very important. Regular high cholesterol develops over time, often lifestyle related, and responds well to diet changes. While familial hypercholesterolemia, present from birth, genetically driven, and diet alone is not enough. That's why telling someone with familial hypercholesterolemia to just eat better is not only wrong, it is dangerous. So that you mean that diet is not important in familial hypercholesterolemia? Completely wrong. Diet is very important with realistic expectations. Diet can lower LDL by 10 to 15% by limiting saturated fatty acid, avoiding trans fat, eating fiber-rich foods, and prioritizing lean protein, using olive oil, and eating fish regularly. But diet alone will not normalize cholesterol level in familial hypercholesterolemia. Medication is usually required, and that's okay. So let's talk about medications and treatments for familial hypercholesterolemia, because this is where people get scared. Well, statins are the foundation of treatment. They reduce LDL production in the liver and they save lives. For some patients, statins alone are not enough. That's why you include Zidia, PCSK9 inhibitors, peptidoic acid, or newer therapeutic injectables. These medications are not a failure, they are protection. If you have lower LDL, that means less plaque, fewer risk of heart attack and strokes. So let's talk about statin fears and myths. I hear this all the time. Someone comes to me and say, I don't want to be on statins forever. I truly understand that, but here's the reality. You're not treating a number, you're treating a risk. So statins don't damage the liver in most people. They don't cause dementia, and they don't ruin your muscle permeability. The benefits massively outweigh the risks, especially in familial hypercholesterolemia. So, what is the LDL target for patients with familial hypercholesterolemia? The goals are stricter. So we aim for LDL below 100 or below 70 if patient has pre-existing heart disease. Lower is better, earlier is better. Every year of high LDL causes damage silently. That's the problem, silently. So how to gauge the heart risk with familial hypercholesterolemia? So you can do coronary calcium score, CT angiograph, or carotid ultrasound. These tests help guide treatment intensity and motivate early action. Seeing plaque changes behavior. What about exercise and lifestyle modification with familial hypercholesterolemia? Exercise is still crucial. It improves HDL, which is a good cholesterol, lowers inflammation, improves insulin sensitivity, and protects the heart. So try to aim for 150 minutes of moderate exercise per week, along with the strength training twice weekly and daily walks. Exercise doesn't replace medication, it complements it. So let's talk about familial hypercholesterolemia in children and family members. This part is critical. Children with familial hypercholesterolemia can have very high LDL early in their life. So screening should start as early as 8 to 10 years old if there is a family history. Early treatment prevents the case of artery damage. Familial hypercholesterolemia is one of the most treatable genetic conditions if caught early. I know there is an emotional side with familial hypercholesterolemia, for any disease basically. And getting a familial hypercholesterolemia diagnosis can be overwhelming. People feel fear, guilt, anger, and confusion. But familial hypercholesterolemia is not your fault. Knowledge is power, treatment works, lives are saved every day. If you would like to take one thing from this video, let it be this. High cholesterol is not always about lifestyle. Familial hypercholesterolemia is real, and early treatment saves lives. If you or someone in your family has very high cholesterol or early heart disease, please get tested. Thank you for watching Dr. Noni's Power Lab. If you want a follow-up video on cholesterol medications, diet, meth, or heart scans, please comment below. Take care of your heart. It works for you every second of your life. I will see you in the next video. Thank you and have a great day. Bye-bye.